All right, let's look at section 9.3, where we're going to cover heart disease or coronary heart disease. Now, with coronary heart disease, it's important to note that for your heart, it is a muscle, and ultimately, this muscle has to be supplied with oxygen to be able to beat and pump and contract. If it cannot get the oxygen that it needs because of blockages, then your heart is not going to beat, therefore, you're not going to be able to sustain life. So, let's look at where our coronary arteries are located, which allow that cardiac muscle and those cells to be supplied with nutrients and remove waste products. So this is an outside look of the heart, and we have the right coronary artery as well as the left coronary artery. And this would be a look at the actual cardiac muscle tissues and how they have capillaries and veins running through those to supply the heart with as much oxygen as possible. Because it is a muscle that never stops beating, just a little human anatomy fact, it's going to be filled with red blood cells needing lots and lots of oxygen. Now, when an artery becomes blocked by fatty deposits called plaques, we mainly call this being blocked by cholesterol. So those arteries are not going to be elastic. They're not going to stretch to accommodate the blood that's being forced through them. And this is what leads to coronary heart disease. You can have a partial blockage of your artery, which is just going to restrict blood flow and ultimately cause really severe chest pains. That's one of the first signs of coronary heart disease. We refer to this as angina. Or you can have a complete blockage, which means that area of the heart will not be able to respire and cannot contract, and this is what ultimately leads to a heart attack. Now, here's a view of how the plaques ultimately block the arteries. You can see it just builds up and builds up, creating a narrow pathway for blood to flow through. A normal artery would just be wide open for blood to flow through. So if you see the artery wall, it's going to be wide open in the center. But if you see an artery wall that has some sort of buildup of plaque, this would be the image that you would see. So you can see blood cannot flow easily through this artery, but it could through this one where there's no blockage. Okay. Now, when we look at the risk factors for coronary heart disease, what leads to this? Ultimately, that's going to be a poor diet where you have too much saturated fat, which leads to increasing cholesterol levels and is going to contribute to the buildup of fatty plaques. Too much stress in your life, oh my goodness. This can increase blood pressure, which increases the chance of a blockage in those coronary arteries. Smoking as well as vaping. Smoking is vaping, just for all of you that don't believe that. Ultimately, nicotine is what leads to this, because again, it increases your blood pressure. So yes, vaping has lots and lots of nicotine, way more than an actual cigarette that you would be smoking. Then genetic predisposition, of course. If you have a history of coronary heart disease in your family, that ultimately puts you at a higher risk. Your age, the risk increases as you get older. And then, of course, your gender. Sorry, guys, males are more likely to develop coronary heart disease than your female counterparts. Okay, now let's look at prevention and treatment. Ways that you can prevent and treat coronary heart disease. One would be stop smoking, get out of the bathroom with the vapes. Ultimately, reduce animal fats in your diet. So eat more fruits and vegetables. That will reduce cholesterol levels and ultimately help with weight loss if you're overweight. And then exercising regularly. This is going to help decrease your blood pressure, help with weight loss management, improve cholesterol levels, and reduce your stress. So we all need to be exercising. Okay, we have a few other ways that we need to look at of treatment of coronary heart disease. The simple use of aspirin can be taken daily to reduce the risk of blood clots. You can have surgical treatments, which include something called an angioplasty, which is where you insert a narrow catheter or tube to open up those arteries and keep the artery clear. This is also called a stent. So you've probably heard of someone having to have a stent put in. This is an image of that. You may also see a coronary bypass surgery of some sort. So this is ultimately going to create a new passage for blood flow to occur. So bypass surgery is something that someone can do to prevent or treat coronary heart disease as well. So that is it for this section. We'll check in with your CFU, and then you guys are going to get to do that exercise activity. Good job, guys.